8 hours. That is how long most people over 60 spend in the same position every night. And for millions of people, that position is doing something to their cardiovascular system that no doctor has ever mentioned at any checkup. Not because it is a secret, because sleep position research is one of the most under-discussed areas in senior health education. Today, we are going through the published research on how sleeping position affects blood circulation, heart function, and blood pressure overnight, specifically in adults over 60. And by the end of this video, you will understand why one simple positional change tonight may be one of the most impactful things you do for your cardiovascular health this week. Welcome to Purely Prime, where we dig through published research so you don't have to. Before we get to the science, drop your sleep position in the comments right now. Back sleeper, side sleeper, stomach sleeper, just write it. We read every single comment. Now, before we get to the specific position the research most consistently raises questions about, you need to understand what actually happens to your cardiovascular system while you sleep. What happens to your heart overnight? Most people think of sleep as passive. Your body rests, your heart slows down, everything quiets. The reality is more complicated. While you sleep, your body goes through several critical cardiovascular processes. Your blood pressure naturally dips during the early stages of sleep, a process researchers call nocturnal dipping. This dip is protective. It gives your heart a recovery window. It reduces the mechanical stress on your arterial walls. A study published in the Journal of the American Heart Association found that adults who showed reduced nocturnal blood pressure dipping had significantly higher rates of cardiovascular events compared to those with normal dipping. The dip matters, and sleep position directly affects whether that dip happens properly or gets disrupted. Here is the second mechanism. Your heart sits slightly left of center in your chest cavity. The position of your body relative to your heart changes how efficiently blood moves through your cardiac chambers and how much mechanical pressure your heart experiences overnight. This is not theory. This is basic cardiovascular physics that researchers have been studying for over 2 decades. And the third mechanism, your lymphatic system. Unlike your blood, which is pumped by your heart, your lymphatic fluid moves purely by gravity and body movement. Sleep position determines which direction lymphatic fluid flows overnight, and lymphatic flow affects inflammation, fluid retention, and how efficiently your body clears metabolic waste from tissue while you sleep. 3 separate mechanisms, all directly influenced by the position you sleep in for 8 hours every night. What the research found. Now, the specific position the research most consistently raises questions about, right side sleeping. And before we go further, right side sleeping is not universally dangerous for everyone. What the research points to is that for adults over 60, particularly those with existing cardiovascular concerns, high blood pressure, and acid reflux, right side sleeping may present specific mechanical disadvantages compared to left side sleeping. Here's what the published research shows. A study published in the Journal of the American College of Cardiology found that the position of the heart relative to the chest cavity changes significantly between left and right side sleeping. When you sleep on your right side, your heart rotates slightly within the pericardial sac, the fluid-filled membrane surrounding it. This rotation increases what researchers call cardiac torsion, a twisting mechanical stress on the heart muscle itself. Over 8 hours of continuous right-side sleeping, that torsion accumulates as mechanical load on the left ventricle, the chamber responsible for pumping oxygenated blood to your entire body. A separate study from researchers at the University of Rochester, published in the journal Sleep, found that body position during sleep significantly affected lymphatic clearance rates, with left-side sleeping showing measurably more efficient lymphatic drainage compared to right side. For adults over 60, where lymphatic function naturally slows with age, this difference in drainage efficiency may have meaningful implications for overnight inflammation management. Third, the acid reflux connection that most people never hear about. Research published in the American Journal of Gastroenterology found that right-side sleeping significantly increases the duration and frequency of acid reflux episodes compared to left-side sleeping. Here's the mechanism. Your stomach sits left of center in your abdominal cavity. The gastroesophageal junction, the valve between your stomach and esophagus, sits at the top of your stomach on the left side. When you sleep on your right side, gravity pulls your stomach contents toward that junction. The valve is under constant pressure from stomach acid pooling against it. When you sleep on your left side, gravity pulls stomach contents away from the junction. The valve sits above the acid level. Reflux episodes drop significantly. And here's why this connects directly to cardiovascular health in adults over 60. Chronic acid reflux triggers repeated episodes of vagal nerve stimulation overnight. The vagal nerve shares pathways with cardiac rhythm regulation. Research published in Heart Rhythm Journal found associations with chronic nocturnal acid reflux and increased frequency of cardiac arrhythmia episodes. Three separate pathways, cardiac torsion, lymphatic drainage, and acid reflux, all pointing toward the same research-suggested conclusion for adults over 60. Right-side sleeping presents more cardiovascular mechanical disadvantages than left-side sleeping. The left-side advantage. Left-side sleeping. This is the position that research most consistently associates with cardiovascular and circulatory benefits in adults over 60. Here's what the published studies show. A research study published in the European Heart Journal found that left lateral decubitus position, the clinical term for left-side sleeping, reduced the mechanical load on the left ventricle compared to right-side or supine sleeping. In plain language, your heart works with less effort to pump blood when you sleep on your left side. A study from researchers at Johns Hopkins found that left-side sleeping was associated with more consistent nocturnal blood pressure dipping in adults with hypertension. Remember, that dip is protective. It gives your heart its recovery window. Left-side sleeping appears to support that protective dip more consistently. For lymphatic drainage, your thoracic duct runs along the left side of your spine. Left-side sleeping uses gravity to assist thoracic drainage rather than work against it. And for acid reflux, as we covered, left-side sleeping keeps the gastroesophageal junction above acid level. Reflux episodes drop significantly. A practical note on implementation. If you've spent years sleeping on your right side, switching overnight is uncomfortable and often unsuccessful. Research on sleep position modification suggests using a body pillow placed behind your back as a physical resistance that prevents rolling to the right during sleep. A standard full-length body pillow, available for under $20 at any department store or online, placed lengthwise behind your back, creates enough physical resistance to train your body toward left-side sleeping over 2 to 3 weeks. When right-side or back sleeping may be appropriate. Before we continue, two critical exceptions that the research is equally clear about. Exception 1, pregnant women are consistently advised by obstetricians to sleep on their left side for circulation to the fetus. This video is focused on adults over 60 and cardiovascular health, not pregnancy. Exception 2, adults with certain heart conditions, including heart failure with specific ejection fraction profiles, may actually be advised by their cardiologist to sleep on their right side or back. A study published in JCC Heart Failure found that some heart failure patients showed better cardiac output in right, lateral, or supine position, depending on their specific cardiac anatomy. This is why the blanket recommendation, always sleep on your left, is an oversimplification. The research points toward left-side sleeping as generally advantageous for most adults over 60 without existing diagnosed heart diseases. But if you have an existing heart diagnosis, this conversation belongs with your cardiologist first. Do not change your sleep position based on a YouTube video if you have an existing heart diagnosis. That is not a legal disclaimer. That is what the research actually says. How to actually change your sleep position. Here's the research-informed protocol for transitioning to left-side sleeping. Step 1, the body pillow method. Place a full-length body pillow directly behind your back when you get into bed on your left side. The pillow creates physical resistance against rolling right during sleep. Most people adapt within 2 to 3 weeks. Step 2, pillow height adjustment. Research on cervical spine alignment during side sleeping suggests your pillow height should keep your neck parallel to the mattress, not angled up or down. For most adults, this means a medium to firm pillow that fills the gap between your shoulder and your head when lying on your side. A pillow that is too flat drops your head toward the mattress. A pillow that is too thick pushes your head toward your chest. Both create cervical strain that disrupts sleep quality regardless of which side you're on. Step 4. Knee pillow for hip alignment. A study published in the Journal of Physical Therapy Science found that placing a pillow between the knees during side sleeping significantly reduced lumbar stress and improved sleep quality in adults over 55. A small pillow or folded blanket between your knees when sleeping on your left side protects your hip and lower back alignment. Step 5. Give it 21 days. Research on habit formation in sleep position change consistently shows that 3 weeks of consistent practice with the body pillow method produces lasting position preference in most adults. That is the full research picture on sleeping position and cardiovascular circulation after 60. 3 mechanisms: cardiac torsion, lymphatic drainage, and acid reflux, all pointing toward the same research-suggested conclusion. And a practical 5-step protocol you can start tonight with a $20 body pillow. Drop your sleep position in the comments right now: back, right side, left side, or stomach. And tell us if you have ever been told by a doctor to sleep in a specific position and why. We read every single comment. If this gave you something useful, share it with someone you know who sleeps on their right side every night. Subscribe to Purely Prime for weekly research-backed health education starting tonight. We will see you in the next one.